Has your child ever suffered from persistent diarrhea and vomiting accompanied by a stomach ache? You might have thought it was the stomach flu, yet this common ailment is not really a flu at all. Welcome to Channel Health and Alerts. Let's know gastroenteritis, often mislabeled as stomach flu. This frequent issue among children is actually an infection of the stomach and intestines. While it's usually caused by viral infections, bacteria can sometimes be the culprit. The symptoms can be distressing, but rest assured, they are part of your child's body working hard to fight off the infection. Now, it's important to know that gastroenteritis typically runs its course in about 10 days without the need for medication. Yes, the first few days can be particularly tough, but don't worry, there are steps you can take to help your little one through this challenging time. In most cases, gastroenteritis passes in about 10 days without medication, but the initial days can be challenging. However, there are steps you can take to aid your child's recovery. The biggest risk associated with gastroenteritis is dehydration. When your child is dealing with symptoms like vomiting and diarrhea, their bodies lose more fluids and essential elements called electrolytes than they take in. This imbalance can lead to dehydration, a condition that's not just about being thirsty. It can affect the heart, kidneys, and other vital organs if left unchecked. So, the most critical step you can take when your child is sick is to keep them well hydrated. But it's not just about pouring them a glass of water. While water is essential, it may not be enough on its own. Why, you ask? Because water alone doesn't replace the crucial electrolytes, salts, sugars, and minerals that your child's body loses when it's dehydrated. So, what's the solution? Drinks that do replace these vital electrolytes. They're called electrolyte solutions or oral rehydration solutions. You can find them at your local drugstore, and they are specifically designed to help replenish lost fluids and electrolytes. However, not all fluids are created equal in this situation. For instance, milk, which is typically a nutritious choice, can actually make stomach problems worse when your child has gastroenteritis. Acidic drinks like orange juice or caffeinated beverages can also cause belly problems and discomfort. As parents, it's also crucial to recognize the signs of severe dehydration. If your child is not urinating, has a dry mouth, cries without tears, or shows signs of extreme fatigue, it's time to seek medical attention. These are telltale signs that their body isn't getting the hydration it needs. Let's remember, the goal here isn't to stop the symptoms of gastroenteritis. Vomiting and diarrhea are the body's way of fighting off the infection. Instead, our aim is to support the body through this process and prevent complications like dehydration. The key takeaway here is to keep your child well hydrated with the right kinds of fluids. Staying hydrated helps their bodies fight off the infection more effectively and recover more quickly. It's a simple step, but it can make a significant difference in your child's health and comfort during a bout of gastroenteritis. When your child can keep down liquids, it's time to gradually introduce food. But remember, not all foods are created equal when it comes to soothing an upset stomach. The first foods you'll want to try are bland ones. Picture a plate of bananas, bread, rice, applesauce, and toast. These foods are easy on the stomach and can help to solidify stools. Chicken noodle soup is another great choice. It's comforting, easy to digest, and the broth can help replenish lost salts and minerals. Crackers can also be a good option, especially if your child is feeling nauseous, as they can help to settle the stomach. Once these foods are being well tolerated, you can start to introduce lean meats and cooked vegetables. Again, keep it simple. A piece of grilled chicken or a baked potato can be just the ticket. However, there are some foods you should definitely avoid. Fried, spicy, and fatty foods can be a nightmare for a tender tummy. They're harder to digest and can exacerbate symptoms. Foods with a lot of acid, like citrus fruits or tomatoes, can also cause discomfort. What about dairy? Well, it's a bit of a gray area. Some children might find that milk products make their symptoms worse. If you're not sure, it's best to hold off on the dairy until your child is feeling better. It's also worth noting that, just as with liquids, the aim here is not to rush your child back to their regular diet. The digestive system needs time to heal, and that means reintroducing foods slowly and carefully. Remember, gastroenteritis is not a race. It's about supporting your child's body as it fights off the infection. That means plenty of fluids to prevent dehydration, rest to allow the body to use its energy in healing, and gentle, easy-to-digest foods to keep them nourished. Remember, with gastroenteritis, it's crucial to reintroduce food slowly and carefully. It's natural to want to give your sick child medication, but with gastroenteritis, this might not be the best idea. When your child is suffering, it's tempting to reach for over-the-counter medicines, but hold that thought. Most medications may not only be ineffective, but they could even exacerbate the situation. The vomiting and diarrhea, as unpleasant as they are, serve a purpose. They're the body's way of expelling the infection, a natural defense mechanism you wouldn't want to disrupt. Antibiotics, while useful against bacterial infections, are powerless against viruses, which are the usual culprits behind gastroenteritis. And anti-diarrhea or anti-vomiting medicines? They might prolong the infection and, in some cases, could pose risks for very young children. The best course of action? Keep your child hydrated and comfortable. Now, while most cases of gastroenteritis resolve on their own, there are times when you should seek medical attention. If the vomiting and diarrhea persist beyond a few days, it's time to consult a doctor. Signs of dehydration are also a red flag. Look out for less frequent urination, a dry mouth, crying without tears, a high fever over 102 degrees Fahrenheit, lethargy, and unusual crankiness. In babies, a sunken soft spot on the top of the head is a warning sign. Also, be alert for more serious symptoms. If you notice blood or pus in your child's stool or vomit, or if their stool is dark and tarry, seek medical help immediately. In cases where the diarrhea doesn't subside, has blood in it, or if you and your child have recently traveled internationally to certain parts of the world, your doctor may need to run some tests and may prescribe antibiotics. While most cases of gastroenteritis resolve on their own, it's important to keep an eye out for severe symptoms and consult your doctor when necessary. Remember, your vigilance can make a world of difference to your child's health and recovery. As with many health issues, prevention is the best medicine for gastroenteritis. Let's discuss some of the measures you can take to shield your little ones from this unpleasant condition. Firstly, consider vaccination against rotavirus. Rotavirus is the most common cause of gastroenteritis in children, and a vaccine can be a powerful tool in preventing the disease. Seek advice from your healthcare provider about the right time to get your child vaccinated. Next, hygiene plays a crucial role in prevention. Encourage habitual hand washing with warm soap and water. This practice is especially important after using the restroom, changing diapers, and before and after handling food. Teaching your kids the importance of hand hygiene from an early age can go a long way in preventing not just gastroenteritis, but a host of other diseases as well. Alongside good hygiene, food safety is paramount. Be sure to thoroughly wash all fruits and vegetables before they are consumed. Cook eggs, fish, and meat all the way through to kill any bacteria that may be present. These simple steps can greatly reduce the risk of gastroenteritis caused by bacterial infections. Now, if the symptoms of gastroenteritis persist beyond a few days, or if there's blood in the diarrhea, it's crucial to seek medical attention. And if you and your child have recently traveled internationally, especially to certain regions of the world, your doctor may need to run tests and possibly prescribe antibiotics. In the end, remember that while gastroenteritis can be uncomfortable and worrisome, most cases resolve on their own with proper care. Hydration, a gentle diet, and time are often the best medicines. By following these steps, you can reduce the chances of your child contracting gastroenteritis. Remember, if symptoms persist, seek medical advice. Navigating health concerns with your child can be challenging, but by staying informed and proactive, you are already doing a great job. Keep up the good work. To recap, Gastroenteritis is a common but manageable condition in children. Often mistaken for the stomach flu, it's an infection of the stomach and intestines, usually caused by viral infections and occasionally by bacteria. The most vital step in managing this condition is ensuring your child stays well hydrated with electrolyte solutions, as the biggest risk is dehydration from vomiting and diarrhea. Introducing food slowly, with a preference for bland options, helps provide the body with energy without aggravating the condition. Remember, milk, acidic, caffeinated, and fatty foods can make stomach problems worse. Over-the-counter medications may seem like a quick fix, but they often do more harm than good. It's best to let the body fight the infection naturally, but seek medical attention if symptoms persist or signs of dehydration appear. Preventive measures such as vaccinations and regular hand washing are your best defense. Subscribe and share to spread the knowledge. Remember, health is the greatest wealth.